Ladies and gentlemen, boys and girls, welcome to another session of podcast. I wish and I'm sure you will enjoy listening to the broadcast.
So, our question for today is on personal hygiene. So, a lot of people get itching in their head. Even if the head is kept clean, there's a certain itching. So, what's the cause of this, and is there some remedy?
Itching in the head is due to many factors which occur. One is you're supposed to maintain your scalp. So, as you know that soap and shampoo, the solid soaps are made with sodium hydroxide. Sometimes they may not suit you. That may be one of the reason. Or shampoos are made with the potassium hydroxide. That may not suit you sometime because they are all called lye, L-Y-E, lye. So that may be one of the reason. If your scalp is completely dry, if you are not greasing it up by oiling your head properly, periodically, twice or thrice a week, those days people always in the ancient days apply oil every day to their head to keep the scalp, the skin very smooth and greasy. Because the scalp is totally a different type of skin compared to your other parts of the body. So you are supposed to maintain it. So if you're going to ask me, even if I do all that, and if I don't use soap or shampoo, if I am going to keep myself clean, if I am going to use traditional stuff to wash my hair and all that, and still if you are going to get itching in your head, in your scalp, then it is because of your contamination of the blood. So it becomes inflammatory. So most of the skin problems in any part of the body, including the scalp, are basically inflammatory disorders. There are certain unwanted levels of inflammatory condition of the blood which are the result for resulting in various skin problems. So you have to treat yourself by cleansing your hematology. Any external application or anything to your head is not going to help. So it is basically an inflammatory problem. If suppose your hygiene is kept well intact and still you are feeling scratchy on your head or other parts of the body, so this is due to certain variations in your hepatology. That is because of the inflammatory unwanted inflammatory part of your blood. Hepatology is liver, study of liver is hepatology.
Right.
So because if the capillary flows are not proper, you always feel scratchy when some of your capillaries are blocked. So you tend to scratch that area where you're giving a pressure so that the blocked capillaries are released. Then the scratchy feeling goes away. If the scratchy feeling is not going away in spite of you scratching that area, then the capillary is not getting released. So it is very important if you go through the net and if you see the number of capillaries underneath your skin. If you take 1 square inch of a skin, they would have shown in the picture how many hundreds and hundreds of capillaries are placed out there. So capillaries are 1/16th of a human hair. That is the thinnest blood vessel in the body where the blood has to flow to nourish that area. So capillary flow normally tends to slow down after the age of 35-40. So your exercising, your body movements and all that plays a lot of role in keeping your capillary flow going. So it depends on how good you take care of yourself with respect to your environment in which you are living, the amount of pollution around you, and then the food and nutrition, the chemical contamination of the food. There are so many innumerable number of factors are there for this kind of a problem. When the hygiene is maintained and the head is going very scratchy, then it is always better for you to look into the contamination inside your physiology. When you clear the hematology, the cleansing of the blood through some medication or the other, these scratchy feelings can be stopped. By externally using certain things, it may not stop. If it stops with external applications of something, it will be good enough that you're eliminated. So these are not inflammatory condition. These are not infectious condition. These are some of the inflammatory condition with which it happens. Okay. Thank you.
Thank you very much for spending your quality time. Thank you very much for your attention. I wish you enjoyed this session. See you later.